Hello, dears, and welcome to Al-Hussaini Virtual Lab Pathology Talks, Tips, and Practical Tips. What I'm going to be sharing with you today is a nice example of metastatic small cell carcinoma from lung origin to the skin. So this is a case of a 70-year-old male patient who presented with a skin nodule. And as you can see here, there is a growth of a dark colored small round blue cell tumor that on higher power magnification, we can see the typical appearance of the small round blue cells with high NC ratio, inconspicuous nucleoli, some myxoidish background, and another area here showing really very monotonous proliferation of those cells with the high NC ratio, with the hyperchromasia, with the scattered mitosis and apoptosis, and then large areas of necrosis. And the first thing that would come to mind is this Merkel cell carcinoma or not. So we did a couple of immunohistochemical stains, cytokeratin 7 and 20, and as you can see here, cytokeratin 7 shows this beautiful dot-like paranuclear cytoplasmic staining that is very characteristic of neuroendocrine tumors, neuroendocrine carcinoma, while cytokeratin 20 was completely negative. And this tends to rule out, of course, Merkel cell carcinoma. Working further on the case, so the case was positive with synaptophysin, showing again this very beautiful characteristic dot-like cytoplasmic staining in the cytoplasm of the tumor cells, and even more beautifully shown here with the chromogranin A, showing this paranuclear dot-like cytoplasmic staining. So this is established to be a neuroendocrine carcinoma that is cytokeratin 7 positive, but cytokeratin 20 negative. So this is ruling out Merkel cell carcinoma. Now, TTF1 was strongly positive in the tumor cells, strongly diffusely positive in the tumor cells. Going back to the history of the patient is a known case of a small cell carcinoma of the lungs. So this would be consistent with metastasis from small cell carcinoma to the skin, which is quite unusual. We know that the skin is a rare site of metastasis of tumors, mostly breast carcinomas in female, but also lung and colonic carcinomas. But in particular, small cell carcinoma is usually associated with dismal outcome, not leaving much time for the patients to develop metastasis, unlike this particular case. We know also that cutaneous metastases are associated with extremely poor outcome, as this was the history was in this case, as the patient succumbed to the disease shortly after the confirming the cutaneous metastasis from the pulmonary small cell carcinoma. I hope you find this tip useful in your daily practice. Thank you.